All right, hello, West Sacramento. I'm Mayor Christopher Cabaldon, and thanks for tuning in for another COVID-19 update. My guest today is the Director of Public Health for Yolo County, Brian Vaughn. Brian, thank you so much for joining us.
My pleasure. Yeah, had to be here.
Yeah, and as I think most West Sacramentans by now know, some of us didn't even know we lived in Yolo County, but Yolo County as an institution and as a backbone of so much of our health and human services infrastructure in West Sacramento and obviously beyond in Davis and Woodland and elsewhere, has really come to the forefront. And all of the key decisions that are being made around local implementation and standards and policies and the monitoring, all the health expertise is in your shop at Yolo County. So we're really grateful that you've joined us today. So first, Brian, the numbers, the latest figures from Yolo County around positive cases and increases, and can you give us a sense of what's happening and what's driving the changes?
Yeah, absolutely. So as I'm sure most people are aware, we're seeing a really significant surge, actually record numbers. That's not isolated to our region. That's largely across the state, and to be frank, across the whole country, largely centered around suburban and urban areas, much like our own. I can tell you, I was looking at the state numbers today, and they're reporting more than 6,000 cases per day. That's been, I think, the two previous days, and we never had cases over 4,000 before that. And so things are surging. We do think it's largely due. We can trace it back to around Mother's Day, Memorial Day. And I think it's really, with our contact tracing, we're finding it's mostly people who are doing social and family gathering, or at least that was the initial piece that's pushing the number of cases moving forward. That is now spreading out, unfortunately. So these people who are in large family gatherings or other events where they're bringing in multiple households together are now going to work, and we are picking up new cases in other spots. But it is largely driven by social and family gatherings, we think. And my assumption is after 3-4 months here, people are letting their guard down. I know with reopening, they may get the message that they think they can come together and gather, and we want to correct that because it is driving these new cases in a really major way.
And I know just today, the governor said he was directing or advising Imperial County, which has seen an enormous increase in its positivity rate. So the rate of tests that come back positive going from 4 or 5% up to 20 or 23%. So he's directing that county to start to go backwards in terms of its practices. Or what is that a possibility, do you think, in Yolo at some point, or are we watching? Is that in your toolbox?
Yeah, absolutely. I mean, well, we certainly take it seriously, and these numbers are really concerning to us. I think the good news is we haven't seen cases, at least for now, associated with the sectors that we've reopened. Again, it's largely around personal behavior, around familial behavior. Having said that, though, if we start seeing cases in those areas, I think we're going to want to consider what are maybe higher risk activities. And again, if we don't get those numbers down or they don't flatten, we want to consider every tool in our toolbox, and that may at some point require us to consider pulling back on some of the activities that have been authorized. I know the state is also looking at that very carefully with a high concern with the number of new cases. And so, our goal is to battle the virus, the pandemic, and we want to make sure we're doing it in a measured, studied, a well-researched way, but every tool is available in the toolbox because we know it's a serious issue.
Yeah, so I know it's really confusing on the ground for folks who are either concerned or not worried about what's going on. Because why are you allowing a restaurant to open up if the cases are heading this way? And what you're saying is, look, we're paying attention to that, but if the community spread that's occurring is happening at the quinceañera or at grandma and grandpa's anniversary party, that even if we were to roll back some of those policies, at this point, it's not clear that those would directly contain some of the spread that we're seeing.
Yeah, that's absolutely right. So we do what's called contact tracing for every single case, right? So we call them up, we do an investigation, and again, we haven't linked anything back to, say, restaurants or gyms. I think for the most part, if people are following the guidelines, which all include social distancing, face covering, the risk is probably fairly low. That's what we're seeing, and it's really when you get comfortable, you're in households where multiple families, often from different regions even, multiple generations, where people, I understand it, probably letting down their guard, feeling comfortable, and that's where we're seeing, at least driving the core of this outbreak right now.
Yeah. Yeah, no, in West Sacramento, part of the just the public understanding challenge that we've had is I'll say this. I've said this already publicly, so I'll say it again. That the sort of the constant reopening has created a mental state that, okay, things must be getting better, because there's no way Brian would be letting me out to go to the barber shop and to the bar if things weren't getting better. And it's just so hard for us to deal with the fact that that can be true, and also at the same time, I have to be actually more vigilant than I was before. Before, I didn't worry so much because I was sheltering at home and everything was closed. And so the challenge as a resident is to have more things open, be able to do more things, but actually have to be more careful and more vigilant than I was during this stay-at-home order.
Right, that's exactly right. And, you know, I understand that difficulty too, because this is unprecedented. This hasn't happened for 100 years. And so we don't have a practice of that, right? So I get the messaging, how it can be confusing. And so, you know, again, we continue to reiterate as much as possible. I think we can certainly do better on communication as well to certain communities and conveying that risk. But it's a tough one, right? We always talk on our side about this being what we call kind of a perfect virus, right? It's not too deadly where it's killing everyone who has it, and yet it's serious enough where we just don't let it run rampant throughout the community, because it does take a significant toll. And so assessing risk, which is, you know, something that people in general aren't very good at, right? Assessing real risk. And so I understand the difficulties with that, and people measuring those differently, unfortunately. And so we're trying to maintain a steady message while also not having the response be more of an impact than the disease itself, right? And so to your point, we want to reopen. We understand the economics of health, right? For me as a health equity person, I understand people's jobs, people's educations have vastly huge impacts on their lifelong health. And so how to balance that, we don't know. It's unprecedented again. There's no playbook to turn to. We're doing our best. We try. And so we'll continue to course correct. We'll continue to do our research and make sure wherever we think there's opportunities for improvement, we're gonna do it, and we're gonna do it full scope as to the best of our ability.
Yeah, I like to this is the kind of crisis that is a reminder that government has a really critical role to play, and the investments in our health system and in all the other collaboratives that we've built over time have been really essential to the response. And at the same time, there are limits to what government can do. And I think, you know, I'm often getting emails or calls or tweets or whatever that say, "Hey, Mayor, why don't you just do that?" And the problem is, like, we don't, neither the county nor the city, we don't issue permits for grandma's birthday party.
Right.
So yes, there could be that, you know, you could issue an order banning all gatherings in any home, and essentially that's what the stay-at-home order originally was. But that's a very extreme measure, right? We don't have the ability to control the principal points right now where we're seeing that happen. And so I think it's hard, but so important that just people say, look, I have to take responsibility here personally, but also it's messy. And you know, I'm not going to get a it's not a green light, red light signal that's going to come from Yolo County Public Health, like, okay, it's completely safe, go out, or it's super dangerous, never leave your home. That's neither of those is really like just one long yellow light where you've got to, okay, look both ways when you're crossing the intersection, slow down, look out for pedestrians, the same kind of activity, behavior that we engage in there. And that's on us. And it's really hard given all the different information that's out there. But you know, even me, if I'm out, you know, getting a cup of coffee or where I'm distancing appropriately, I have to constantly remind myself, I don't know what everyone else in this coffee shop has been doing. They may have all just come from grandma's birthday party. And so we all just have to take it upon ourselves to be as careful as possible, and also as careful as is mandated by the law. And I know both you and we have iterated and tried different approaches to communicating to folks, hey, it actually is that you must wear a mask indoors. It's not, and sometimes you and we will both say things like, you know, whenever possible, or socially distance when possible, or I don't like that, because I feel like people need to know it's actually, it is the law and we must do it.
Yeah.
And I think I could hear yesterday the word coming from the county that you're also, starting to play seriously with businesses that may not be compliant.
Yeah, absolutely. And that's a good point. We're always remiss to want to do enforcement and to force people, right, to do anything. And, to be frank, I don't think the answer is policing gatherings, right? That's just not going to be effective. But certainly when there's egregious violations, I think we've tried really hard to be supportive, to educate. But, like anything, there's a gradient, and there's certain people who are willfully acting out of a lines that we think, or out of the guidance that put people at risk and significantly. And so we do think one of the tools in our toolbox is we have to do better with enforcement, right? Especially now that there's more virus out there, there's more cases out there. We want to be more vigilant. And so unfortunately, that's one of the avenues we have to do, because education can only go so far. So if there's restaurants willfully violating, the next option is to step it up and say, hey, we've given you every chance. We want to be supportive as possible, but you're actively not following the guidance and putting your community and your patrons and employees at risk. And so we're going to step up enforcement as a result of that. But for the most part, that's not going to solve our problem. The bigger issue, right, it's really about personal responsibility. And it's kind of fascinating to me because this is such a unique virus. Everything about it is pretty kind of weird and unique. And yet it is falling now on the same old public health sort of practices, right? How do you get people to stop smoking? How do you get them to eat better? And those are long-term, those are conversations. Everyone knows we should be doing it, and yet it's a difficult thing to change personal behavior. And so we're going to try, we're going to do our best, but it's still that same sort of feeling now. Is it's going to take a real investment. It's going to take people having to step up, and it's not going to be just on us. It's really a community coming together, like we did initially, right? Really felt that community going indoors and being protecting ourselves, and we certainly want to hopefully engender that feeling again, especially now that we're seeing the surge that we didn't see before. To be quite honest, it's coming to us now. So we implore everyone to please follow that. No one wants to go back to where we were before. In order to do that, we all need to play our part.
Yeah, and I think that is such an important point, because if we end up in a situation like Imperial, God forbid, but
yeah.
The answer at that point won't be, let's still have bars, but maybe not nail salons. Yeah. It's not going to be if we end up in a dire situation like that, your toolbox isn't going to be, I'll make a little tiny change here. It will probably look more like a much more rigorous stay-at-home order, like we were under before, and because we won't have the option to see if just nail salons alone work in order to get us back down again. And so I know we're partnering with you at the county, and we're looking also at for those businesses that are willfully violating and creating unsafe conditions. We're thinking about revoking your business license, turning off your water service, other sorts of things that make it clear that this is not just best practices, and we're not Dear Abby. We it's our job. It's our job as a community to collectively, in solidarity, implement these kinds of provisions.
Yep, absolutely.
So, for those that don't know, COVID-19 testing at Club West here in West Sacramento has been extended through next week, through July 3rd, and that's at the far north part of the city. And it's the center for asymptomatic testing in West Sacramento. It's available for all of Yolo County, of course, but it's the key point where we can get a sense as a community, and you as a county, like, how are we doing with folks that aren't yet presenting with symptoms? The sort of testing where you go to your own doctor or to the pharmacy with the doctor's recommendations is very important, obviously, if you are presenting with symptoms. But by the time you're presenting with symptoms, it's also possible or likely that you've already infected others. And so asymptomatic testing is the key sentinel for us to know as early as possible, and before the spread has gotten wildly fatal and beyond our control, what's happening. So that's been really important, and our partnership with you has been key in making that available. I understand we've had an average of more than 100 residents being tested every single day at the center. I know I did. I was there first couple of days. It was ridiculously easy. I made an appointment online, same day, was quick. I didn't pay anything. Went in there, the protocols to make sure that there's no contact with anything or anybody were impressive. And it was very fast and sure, it was uncomfortable, but by the time I realized how uncomfortable it was already over. It was like a super fast thing. So how's that testing going, and how's that relate to your the contact tracing efforts?
Yeah, to your point, it's actually going really well. So I know we're getting close to capacity each day. I think we're at capacity each day in terms of the number of people that are coming in. And to your point, it's really the single point. For anyone who wants to go get tested, that's the place to go, right? Regardless of whether you're symptomatic or not. And we've certainly relied it too to get quicker testing than, say, going through the healthcare system. And so it's been a valuable resource for us. We're glad that we could work with the state to set that up. They've extended that service for the county at least through the end of August, with a discussion of they'd be available for us to use through November. And so it's a big piece of our testing. We're not relying on it solely, though. We still want to get out and do more testing. So I know some of the farther flung communities in the county, we want to make sure that we get testing out there. We're in conversations about whether the fire departments can hold some of that testing too, to allow for access in some of the rural areas. I think, especially now with the trends we're seeing, we're really gearing up to do some mobile testing so we can be a little bit more fluid and go out to certain locations. We'll have some news hopefully next week about what that's going to look like. But I think for now, given the trends we're seeing, it's really important that we continue to be able to go out and do that type of testing. I think one thing that I found out in this whole thing is just how fragmented our testing system is. In addition to our healthcare system, we don't have a system that does surveillance and public health testing. It's largely centered around diagnostic testing when you go in and get, your testing when you get a physical. That's what it's really set up for. It's not set up for ongoing long-term testing. And so, other governments who've done that, they've done that from a federal level. We don't have that now. I know the state is pushing forward. So we're working through that system now. We'll have stuff out there, though, in the coming week where we're going to ramp that up too, in addition to the sites that are already out in West Sac. So that'll be a continued piece of it, right? In addition to the contact tracing. So when we do find cases, we can make sure we're responding quickly to those cases and trying to prevent them from exposing others.
So how does the contact tracing, how does that work?
Yeah.
We hear a lot about it now, but it's a totally new concept to almost everybody that hasn't worked in public health.
Sure.
How do you do that?
Yeah, good question. So it's something we do in public health regularly, daily. Certainly not to this volume, but and the way it works, it's very basic. So we get a case, before it'd be syphilis, tuberculosis, now it's COVID. And the thing we want to do first and foremost from a public health perspective is reach out to that person and make sure they're not infecting others. Or if they have been in proximity with others, can we identify them to get them tested to make sure that they don't get sick? So it's really about being supportive. What we do is we get a positive case, it gets reported to us. First thing we do is we give people a call. We ask them, hey, how are you feeling? 1, 2, where have you been? When did you start feeling sick? So we start identifying a window of when they may have be infectious. And then we start talking to them about, hey, what are other people you may have been around, right? May you've exposed other people? Could they possibly be sick? And so we do this big case investigation. We determine points for follow-up where there may be exposures. And this is the way you sort of limit that chain from continuing to grow, right? This is the only way to do it, in fact, is you got to get in there, investigate, and then reach out and make sure people are either going into their home and isolating so they can't infect others while they're infectious, or they're going to get tested to make sure that they haven't been exposed and aren't infectious. And so that's all based on contact tracing, right? That's the only way to do it. And so we get out there, we call every single case. We're pretty fortunate that we've been able to build capacity to follow up with every single positive case we've had in the county. We continue to do that. And so it's fundamental to any strategy moving forward is testing and contact tracing, because the two work hand in hand.
And then, so if you get a report that I'm tested positive and you want me to isolate for a while, do we have supportive isolation in Yolo? Like if I can't work if my job requires me to go and I can't, or if my housing situation doesn't permit me to separate myself from other household members?
So we do what we consider other support screening. So as part of that process, we want to make sure that people can isolate, right? And we know there's differences in terms of resources and means of being able to do that. So, it's kind of the mishmash too of there's federal regulations now that protects people's jobs, maybe provide them additional leave, emergency leave should they need to take that time away. We certainly want to assess whether they can isolate at home. We have hotels that we can provide people to if they can't. Some of the stuff that's been popping up lately is stuff that's existed before around a housing crisis or other inequities too. That certainly does make it more difficult if say a family's sharing a house with two other families, or there's multiple generations in there. Even their ability to isolate is limited, and so we want to make sure they're offered other services, or they have a place where they could go to isolate, and that's all part of the conversation when we do that interview. If they need food delivery, if they're seniors or they may be isolated, we also want to make sure they get connected with services that we've built in the county for delivery, at-home services, cooked meals. If they need health care, if they're symptomatic, we can certainly, if they're not covered now, try to get them on Medi-Cal or get them into one of our federally qualified health centers to get support too. And so we try to wrap around as best we can with the number of cases we have and make sure people are able and they're supported to isolate.
Right. It's so important because,
Yep.
I know there are some folks who are like, I think I might have been exposed. I want to go, I want to get tested, but I'm worried about testing positive, and then my entire economic situation collapses. And so the suite of wraparound services that you're talking about, and the advocacy and the connections and all that, especially for folks who, if their first language isn't English or they have other
Yep.
communication barriers, saying we can't just say to them, hey, call your employer and see what can happen. Having that kind of support and advocacy is so important in order to
Yep.
make sure that everybody's getting tested. It's also really encouraging I can't wait to hear what you've got to say about mobile testing soon, because part of what we know is both here and elsewhere in the county, all around the country, is that reaching people where they are is really critical to identifying differences among communities. I mean, I think what we've seen in community after community has been, particularly just as one example, that Latino positive testing outcomes have been much higher. And I saw this for the first time in New Orleans a few weeks ago, but they only discovered this because in New Orleans, because they were out mobile testing at food distributions and at church services and what have you. So they were able to reach people who would not necessarily have affirmatively signed up for a test,
Right.
As well. And so being able to see the disparities, and I know we're concerned about that here in West Sacramento too. Mobile testing could be really helpful.
Yeah, absolutely. Totally agree with that too. And other counties I know have gone out and tested vulnerable populations. And again, the patterns are becoming clear to us too. It's the same communities that are suffering disproportionately from other diseases are now being the ones who are popping up on the radar for a multitude of reasons. One, I mentioned the housing issue, but all these other things around access to care, stability of jobs, right? To your point as well, ability to even just work from home, right? So we know lower income communities tend to be in the service industry. Those are those essential workers. And so they don't have the option necessarily like other communities to work from home, which again, further opens the risk for exposure. And so there's all this stuff that existed before, right? That's playing itself out now in this pandemic in ways that are probably predictable in some ways, and in other ways not predictable.
So when is everything going to get back to normal? Are we looking at 8 days from now, or 12
that is the $1 million question? I think the normal answer is when there's an effective therapeutic or a vaccine, right? I always tend to couch that the vaccine won't be a panacea. We have a vaccine for the flu, and yet it kills thousands of people every year. And so I do think there's a level of, we have to understand that COVID will probably be with us, similar to the way measles or other diseases are with us. I think the big thing is it in a way that we can manage, we can treat with a pharmaceutical or other therapeutic, and do we have a vaccine to protect most people? I think, I've heard promising things around therapeutics lately. I know there's any number of testing going on. And so I think things are progressing. I was on with a call with a physician, an infectious disease doc last night, and he was telling me it's night and day actually with the number of tools he now has even now compared to where he was 2 or 3 months ago. So that's promising. But the big picture is it's with us. It's going to be with us for a while, absent a really effective vaccine probably. And even then, it could go the way of the flu, where you have to get vaccinated every year, or you have to get a vaccine every year to maintain your immunity. And so there's a lot of unknowns there. I don't like to say this is the new normal, but at least for now, again, absence any big development, this is the way it is. It's going to be now. And to be frank, this disease is a little bit strange. We did think over the summer, similar to the flu, we thought we'd kind of keep a steady low level. That's actually what I was preparing for. And it's really odd now that it's kind of popped up again. And so it's not acting like viruses that we know of or are very familiar with. And so there's some unpredictability out there too that certainly keeps me up at night, makes me anxious. And so some of it will have to play out. I have no idea now what even August will look like, let alone next year. And so, again, we're going to do our best. We're going to use the science that's available. I know there's a lot of great research happening out there. We'll adjust and course correct as we move forward. But for now, it's with us, and we need to take all the caution possible to make sure we don't get infected and infect others.
Yeah, we had a mayor's call with Dr. Fauci earlier today. Yeah. And he reinforced, look, in my entire career, I've never seen, none of us have seen a virus like this in many, many ways. Much of what you just said, but also in the spectrum, just the incredible spectrum of responses by people who contracted, from absolutely nothing to death and everything in between. That makes it, in addition to being a health problem, it's a problem for us as just individuals to process. Like in our mind, what is the threat here? Well, it's all the threats. It's the full range of them. And the science is progressing rapidly, but it is still science. So there's a lot more to learn, a lot more surprises to be had of. It seems like just in some sense like a decade ago, or some like an hour ago, back in February and early March, when we thought, just wash your hands, just wash your hands and we'll be fine. And we've learned so much, and we're going to continue to do so. And so. I know in our city we've taken the science seriously, taken the expertise of the public health experts like yourself very seriously, because frankly, public opinion about everything has changed 180 degrees roughly every other hour. So we've tried to stay focused on what's the best that we know, what are the best decisions that we can make. I know that's been happening at the county level too, so I want to thank you for the work that you've been doing, and your colleagues, Dr. Chapman, the retiring public health officer, and also the board of supervisors, which has been very, very steadfast in its approach on this work. And of course, it wouldn't be West Sacramento if I didn't acknowledge specifically our Supervisor Villegas, Oscar Villegas, and Gary Sandy, who've been both advocates for us, but also very strong on these issues. So we won't be normal by this weekend. And the weather's warm, and we want to get out. And as you've said, there's a lot of health benefits to interact, to having a social connection to other human beings, and also to exercising and being outside. Yeah. And it's summer now. So give me some advice. It's a gorgeous weekend. Normally we'd get out and hang out with other people. And what's your advice and your message for how West Sacramentans can help prevent the spread of the virus, protect themselves and others, and still enjoy a nice Saturday and Sunday?
Yeah. Well, certainly getting outdoors helps. I think the science is clear that indoors is much higher risk, right, than outdoors. That doesn't mean if you're outdoors, you're not going to contract it. Again, it's both a complex but also a very simple message, right? You got to keep your distance, right? If people are sick, they can't go outside. They shouldn't be going outside, exposing others. Wear a face covering as much as possible. And while gatherings aren't permitted, we don't want you to be isolated, living like a hermit too. We understand the need for social connection. So just make sure you're vigilant there about keeping your distance, keeping safe, washing your hands, don't share items. In some ways, it's a very simple message, but it's one that without vigilance, the virus doesn't care, right? It doesn't care if it's a sunny day. It doesn't care how lonely you may be. And so I think there's a balance to be struck that if you're going to go do these activities that put you at risk, to do them as safe as possible, to keep that distance, avoid hugging and shaking hands if you can, And you can still talk and be at distance, but just take every precaution that you can to prevent the spread. Because even if you yourself are at low risk for, say, complications, you have to go home, you live places, you work places, you're out interacting with other people, and you put them at risk. And you know, I think about it myself, and the worst thing I would have is to get someone else sick who has complications, who goes in the hospital. For me, I would never be able to live with myself with that. And so I hope others feel that too. And you know, and again, I know it's become a political issue too, and I just stress that the virus doesn't care about our politics, right? And so as much as you can just understand that this is a virus that travels, it travels fairly easily. And so please, regardless, just take common sense approaches around distance and covering your mouth and washing your hands as much as possible. They're not political acts. I hope people don't think they are, because again, the virus doesn't care. It's with us, and it wants to spread. It's its primary goal. And so I think having a show of that, while to a certain extent, I guess I understand it given the climate now, I just want to stress to people that, you know, if you support your community, you support this country, and you want us to thrive, then we can't be sick in doing that. So please take every precaution you can.
Yeah, I give one more tongue-in-cheek precaution, which is don't hang out with people that you don't like, because yelling at the top of your lungs at somebody you're angry with, it increases the amount of droplets.
There you go. Yeah.
Only hang out with people that you can talk softly with.
That's right.
Yeah. So thank you very much for that. For that, Brian. I think it's the way for me, the way I think about it is, and it keeps me sane, is to remember that right now we're still in the first wave. Maybe right now at the most challenging point of the pandemic yet. And so I think about the weekend as how lucky I am that compared to 2 months ago, I can have any relationship with any other human being outside of you know the house, and I can go outside and I can get a nice meal somewhere. And so I think about how fortunate we are right now, given that the pandemic has not receded at all, as opposed to comparing it to life entirely before the pandemic, or how I hope things might be in 6 or 9 months from now. And for me, that gives me a lot more calm, as opposed to the anxiety that I know so many people are feeling about how to be safe. And if we think about it think of it still being late April, early May, when we had that sense of common purpose and solidarity and understood what we needed to do, let's stick with that. And then just rejoice in the opportunities that we now have that we didn't then, to be able to have a little bit more human connection, a little bit more activity, and do our best to box this thing in. So
that's a great point.
Brian Vaughn, Director of Public Health for Yolo County, thank you so much for sharing the critical information, for your continued leadership. I'm sure you are, like so many, working 28-hour days in order to try to keep us safe. But thank you so much for the leadership and for the discipline that the county has been exhibiting, and the humanity as we've combated the virus here in Yolo County. Thanks for your leadership. And for folks who are watching, please, for additional information, you can always check in at the City of West Sacramento homepage for the latest at citywestsacramento.org. And from there, you can also connect to the Yolo County Public Health page. It's also easy to find, and get the roadmap for recovery, dashboards on where we are. Certainly, all kinds of advice about what safety precautions can be taken and should be taken, what the state of the law and the orders are. There's a wealth of information out there to help, but also the easiest is just to follow the guidance that Brian just described, which is simple, easy to do. Maintain that distance, avoid large gatherings, wear that mask. If you're sick, stay home and get tested. So thanks again for joining us, Brian, and stay safe, West Sacramento.
Yeah, you too. Thank you. Appreciate it.